corridors of health. And we'll just buckle down to what is happening today. The first international conference on COVID-19 will be happening at Kenyatta University. Now, it is a meeting that will be attended by key stakeholders, starting from First Lady Margaret Kenyatta, CS Health, this is Amatai Kagwe, Secretary General Red Cross, Dr. Asha Mohammed, among other dignitaries. Now, key issue is to look back at 2 years of COVID-19 pandemic and the way forward. And Saada Hassan, she's joining us from our city center studios to just give us also an inside scoop of this particular international conference. Saada, good morning, good to see you.
Good morning, Dibal. And indeed, it is a very important conference that is starting today at Kenyatta University, whereby key stakeholders will be attending, as you have rightly mentioned. And the importance of this particular conference is that we are going to be able to look back at the 2 years of COVID-19, the steps that we have taken so far to ensure that we manage the pandemic, and looking forward, how are we going to manage future pandemics? Because as we know, viruses are there and they will still keep on coming and replicating themselves to ensure that they survive within any kind of environment. So of importance is to look back at the economic measures, the social measures, because during the 2 years of COVID, especially here in Kenya, we saw a lot of issues rising out, and key among them is GBV cases. They increased during the time of COVID-19 pandemic. We saw that people were supposed to stay at home because that was part of the mitigation measures of ensuring that we manage the pandemic, and this was quite a big issue because mental health issues came out. We also had issues of trusting the government and trusting the healthcare professionals. So this goes back to policies formulation and how much do we trust the government to give us things like vaccines to ensure that we are protected as Kenyans. So this is a conference that will also look back at the trust between Kenyans and the government, and the trust between Kenyans, the government, and the healthcare providers. Also issues of putting healthcare providers at the forefront where they're supposed to be, because these are people who interact directly with Kenyans day in, day out, and adhering to some of the measures or some of the issues that they keep on saying that this is a problem in the health sector and we need to deal with that. It is of importance. So these are just some of the issues that are going to be looked at today. And most importantly is what are the measures that are going to be put forward to ensure that we continue to manage the COVID-19 pandemic or any other kind of pandemic that comes in future. So this goes back to investment, to policies that are in place. For example, right now, sometime back last year, we saw that the government decided that moving forward, Kenya will be part of the manufacturing, will be manufacturing some of the COVID-19 vaccines. So this has not yet been achieved. But what are the measures being put in place to ensure that moving forward, if we have a COVID-19 pandemic continuing, then we will be able to manage it ourselves and we don't have to rely on other people, because we saw that reliance on external parties can also be a challenge, because we saw a lot of issues coming out within countries and a lot of iniquity is coming out during the vaccine sharing process. So these are just some of the issues that are going to be discussed today. It is a two-day forum up to the 14th, and key stakeholders are supposed to deliberate on the way forward of this issue that is affecting not only Kenyans but also across the globe, because COVID-19 is still there, even though we are still recording very little cases compared to 2 years back. Dibal.
Yes, indeed, and a very providential time to have this particular conference. In light of what is going on also in the world, people are easing off the restrictions as well. But also, Saada Hassan, in Shanghai, in China, they are still under lockdown. And we're given to understand also there's a child-mother policy on separation. Numbers are skyrocketing as far as COVID-19 is concerned. We can see the resumption of that in that particular country. Remember, this also was the epicenter of COVID-19 where it broke out. And as that was happening, the world also was just resting on their laurels as well. And this, as you say, given that we are preparing for another pandemic, US as well is on that particular beat right now, where they are preparing for the next pandemic, even as they're easing restrictions.
Absolutely. Yes, and it is quite important for us because especially here in Kenya right now we are into the campaign season, we are into the election period. And right now all of the measures that were put in place earlier on, like putting on masks, washing of hands, using sanitizers, all of that is now thrown away into the bin because after the government eased restrictions, the not majority of Kenyans are still adhering to some of these measures like wearing of masks. Just walk through here in Nairobi CBD and you will count a number, very few people who are still putting on their masks. So it is quite a critical period, not only for Kenya, but across the globe, because normally, and according to how we've seen the curve rising, the wavelengths over in and out during the 1 year period, we've seen that the moment people relax, or the moment here in Kenya particularly, the moment we relax our measures, then the numbers start rising. But over time, when also people are there or are able to get herd immunity, then we are able to control that pandemic. And according to World Health Organization, at least when the country is able to maintain at least a 5% level of COVID-19 cases and new infections and managing of it, then it means the country is at a good state. So right now we can say that we are at a good state, but we definitely cannot say that that is the end of it, because we've seen viruses, replication of viruses. We hear of Delta, we hear the next time there's Omicron. So these viruses will still keep on replicating. And we, as you have mentioned, yes, we've seen that some countries like China, they have gone back to some of the measures that they had put in place. And right now they're preparing for the worst, because we've seen the COVID-19 cases rising in that country. And this, since right now we have open border, we have flights coming in and out, we have people moving in and out of countries, then we cannot be so safe, because as we keep on moving, then we keep on interacting with people, we keep on touching surfaces, then at the end of the day, it is possible for us to keep on carrying these viruses and transmit it to other places, or also be silent contributors of this pandemic. Debal.
Thanks, Hassan, for that as well. And still on that health beat, Kenya is once again on the regional map as far as medical milestones are concerned. The Medihill Hospital has successfully performed a rare heart surgery known as transcatheter aortic valve implantation, or TAVI, on an 83-year-old patient. According to the facility's experts, TAVI is a rare surgery and the first of its kind in sub-Saharan Africa. This makes Kenya a top regional destination for medical tourism. Our health and science reporter Chebet Berir has more on this.
A few days ago, 83-year-old Brambila Luigi was a worried man. He had been experiencing shortness of breath, but now he can sigh in relief as he hopes to live longer. This follows a successful valve replacement in his heart. Brambila, who is a Catholic priest at the Consolata Shrine, was diagnosed with aortic stenosis. This may cause the aortic valve to degenerate and struggle to open well. As a result, the heart struggles to pump blood through the narrowed valve. This leads to symptoms including breathlessness and chest pain. Some people may experience dizzy spells when exercising, which may lead to fainting.
For this patient, we did the 2D echocardiography, which showed one of the heart wall, it's called aortic wall, which was blocked significantly. And the gradient was more than 100, that is 110 by 54.
What does that mean?
So the gradient, whenever is high, anything more than 40 mm of Hg gradient across any valve means that valve is stenosed or blocked, and it is blocked significantly. And such patient will develop this shortness of breath, they develop the dizziness, giddiness, syncope, and they will develop the chest pain.
The procedure cost about 7 million Kenyan shillings locally. It was handled by more than 10 specialists and took about 2 hours.
This is a placed valve there, which is having some diamond shaped rims, okay, and over this wire we have implanted, and this is one area from where the blood will come from the heart to this main tube, and there we have placed this valve, and you can see the calcium previous stenosed valve, which is now opening well, and there is no gradient across this valve after implantation.
Brambila is now recovering as doctors observe him.
After 6 hours, patient can walk. Ideally, in some countries, even for 1 day we are keeping, and next day even discharging. But for this patient, we are keeping 2 days, maybe maximum 2 days hospital stay will be there for patients.
Many patients and their families in Kenya seek services abroad to treat or manage heart problems. According to Dr. Patil, this rare surgery is proof that Kenyan doctors have what it takes to treat and handle such delicate diseases. Chebet Birir, KTN News.
Right, congratulations.